The cost of inaction on teenage pregnancies in Uganda. The National Planning Authority, in partnership with Uganda Population Council and the United Nations Population Fund, carried out a study on the cost of inaction on teenage pregnancies. The study was anchored on Agenda 2030 through the Sustainable Development Goals SDGs number 3 and 5, as well as Africa Agenda 2063 and the East African Community Agenda 2050, which speak to the well-being of all people, gender equality, and empowerment of all girls and women. The Uganda Vision 2040 recognizes that today's young people are the drivers to achieve a transformed society from a predominantly peasant to a modern and prosperous society within 30 years. Consequently, the Human Capital Development Program of the Third National Development Plan, government seeks to reduce teenage pregnancies from 25% in 2020 to 15% by 2025. It is therefore imperative that the right interventions are made to ensure that aspirations set out in Vision 2040 are met, with harnessing of the demographic dividend as one of the strategies for the ultimate attainment of the vision targets. The cornerstone of this strategy is rapid fertility decline, arising from young people delaying marriage and childbirth as they complete their education and build careers, which will eventually trigger the age structure transformation and in turn effect harnessing of the demographic dividend. Prevalence of teenage pregnancy will undermine this strategy in various ways if no action is taken. Key findings from the study. The magnitude of teenage pregnancy. Childbearing has existed in Uganda for several decades. The percentage of women aged 15 to 19 who have given birth or are pregnant with their first child declined between 2001 and 2006 from 31% to 25% and remained stable at 24% in 2011 and 25% in 2016. The 2020 National Survey on Violence revealed that over the last 45 years, more than half of the girls have experienced childhood sexual abuse, which may also explain the unchanging level of teenage pregnancy. However, the current generation has slightly reduced from 64% to 50%. The social cost of teenage pregnancy on individual education attainment. Mothers are more likely than non-teenage mothers to attain only primary level education, and on the other hand, teenage mothers are 6 times less likely to complete secondary education compared to non-teenage mothers. Therefore, keeping girls in school reduces teenage pregnancies. Occupation. Teenage mothers are 3 times less likely to have professional jobs and twice more likely to be self-employed in agriculture. About half of the teenage mothers, about 47%, are peasants in subsistence agriculture. Only 5% of teenage mothers are employed in professional occupations. Subsequently, teenage mothers will have a lower income level that eventually affects the standard of living and contribution to productivity. The social effect of teenage pregnancy at the macro level. Contribution to newborns and the population at large. Teenage pregnancy is responsible for nearly 1/5, about 18% of the annual births in Uganda. Nearly half, 46% of the births by teenage mothers were unwanted pregnancies. Contribution to infant and maternal mortality. Teenage pregnancy contributes 20% of infant deaths in Uganda and on the other hand contributes to 28% of the maternal deaths. If no action is taken to reduce teenage pregnancy, teenage mothers may continue to lose their lives in childbearing. The economic cost of teenage pregnancy. Individual level healthcare costs. Per capita reproductive health expenditure, that is to say, what each teenage mother therefore spends is $280 on herself and baby health care. Per capita expenditure for minor health care of a child per episode is estimated at 29,645 Uganda shillings, about $8. Macro health level healthcare costs. families of all teenage mothers in 2020 spent 1.28 trillion Uganda shillings, about $290 million on sexual reproductive health services, and the estimated health facility expenditure on teenage mothers was 246.9 billion Uganda shillings, about $70 million. Collectively, this is equivalent to 43% of the Ministry of Health 2019-2020 budget. The largest amount of expenditure is spent on normal delivery and the care of newborns. Macro-level education costs. Projections show that families of all teenage mothers in Uganda in 2020 will spend 689.9 billion Uganda shillings, about $194 million on children born in 2020 to complete secondary education by 2038. Expected healthcare and education savings at macro level. If the current teenage pregnancy rate is reduced from 25% to 10% as targeted in the current health sector development plan, then each year, about half of the healthcare expenditure for teenage mothers will be saved, equivalent to 592 billion Uganda shillings, and the per capita healthcare expenditure will reduce from about 1 million to 400,000 Uganda shillings. The resultant education cost for children born by teenage mothers of over 53 billion shillings will be saved. Recommendations. The following are key recommendations for actions by stakeholders of teenage pregnancies. Improve access to sexual and reproductive health information and adolescent-friendly services, and ensure that healthcare providers have skills to offer the services in a non-judgmental manner. Strengthen district-based capacity building for evidence generation and use for sustainable planning and response to teenage pregnancy challenge. Prioritize and strengthen community engagements at district, sub-county, and parish levels for collective action against teenage pregnancy and child marriage for evidence and knowledge sharing. Develop evidence-informed social behavior change communication materials to address the drivers of teenage pregnancy. Advocate for and implement programs geared towards girls' enrollment, school completion, complemented with sexual reproductive health information to enable them make informed choices. Support policy and program initiatives for pregnant adolescents and adolescent mothers to be able to return and stay in school. Accelerate the finalization and implementation of key policies that address adolescent sexual reproductive health rights, thereby translated into implemented ordinances and bylaws. Strengthen the legal and policy framework supporting effective enforcement of existing laws prohibiting child marriage and defilement, improve intersectoral collaboration, and enhance capacity for service delivery to fight against sex exploitation, abuse, and child marriage. For the detailed report, visit the National Planning Authority's website www.npa.go.ug/publications and the UNFPA website www.uganda.unfpa.org.